చెస్ లేకపోతే హాఫ్ ఆఫ్ మనం సక్సెస్ అయిపోయినట్టే. అంటే ఈ అన్ని విషయాల్లో మనకి ఎగ్జామ్ ఆగలే మనకు, అంటే మన దేవుడు మనతో మాట్లాడే కానీ వాళ్ళు కానీ ఇప్పుడు వెళ్తాం కాబట్టి తెలుసుకుంటాం. అంటే ఐవాస్ కోర్సు మామూలుగా ఇచ్చేసి రాసు అంటే మ్యామ్ నాకు అంటే ఇంకా పేషెంట్ వచ్చి సార్ చూడండి మ్యామ్ దగ్గర కొట్టలేరు, మ్యామ్ దగ్గర అప్పుడే ఆ పేషెంట్ లాక్కుంటున్నాం. అంటే
డాక్టర్ కృష్ణమోహన్ సార్, వైస్ ప్రిన్సిపల్ డాక్టర్ కిషోర్ సార్, డాక్టర్ తిరుపతిరావు సార్, అండ్ హెడ్స్ ఆఫ్ ద డిపార్ట్మెంట్ ఆఫ్ సర్జరీ విజయ్ కుమార్ సార్, pathology Ramani madam, Swati madam, and professors pediatric Dr. Salim sir, deputy superintendent Dr. Ravi Kiran sir, and Dr. Arna madam and Srikanth sir, and dear doctors, hearty congratulations to all of you. Your journey of medical profession, real journey, starts from now. Earlier, you are all students of this government medical college. As you have finished your academic training all these 4.5 years, and you have successfully passed out all the subjects, and now you have entered into real medical profession. The journey to serve the patient, to be a compassionate and excellent doctor. See, this compulsory internship program is for a period of 1 year. All of you have your own plans. I know that your seniors might have told you that you can attend only major departments, and for the rest of the department you can join online courses, and you can attend the classes from Hyderabad, and you can go to coaching centers, and in between you can come up and go to your places to attend the online classes. It is not true like that. Don't prepare that. This is a period where you have time to prepare for the entrance examination. What I tell you, the real patient will teach you the subject which is required for your entrance examination. What Tirupati sir told you, whatever the patient you are going to see, the clinical symptoms and their presentation in the words and their investigation part, everything is very, very important and crucial, and the knowledge of your clinical skills is tested in entrance examination. It is not that you have to by heart everything. All this knowledge part already you have covered during your all this 4.5 years of training. You are all masters in theory now. Only thing, you are supposed to have a real life clinical knowledge. All those who are excellent in theory may not be excellent in real life scenario. Those who take the clinical skills, who train clinical skills, and those who have good communication skills will be a successful doctor. Don't think your distinction and your first classes in your MBBS career is going to help you. Those are not going to give you any added advantage in your real life practice. What is expected out of you during this 1 year of internship training is to have a good communication. What is that good communication? Good communication doesn't mean that you need to explain everything to the patient before the patient tell you his own complaint. Communication is active listening, as Kishore sir said. You listen to the patient. First thing, you pay attention to the patient and their relatives. Half of the disease you are going to cure by listening to the patient complaints. Since we are all first line doctors facing the patient in our hospital, everyone sees you as a qualified doctor only, because they don't know the difference between who is a qualified doctor, who is postgraduate, who is intern, who is assistant professor. Maybe they may be identified with a grey hair and mustache and all, but thing is that you are all equal to a qualified doctor now. Assume that yourself that while listening to the patient, your duty is to record all the patient complaints. History taking is very, very essential. History taking of the patient. That is what your role is. And documentation part. You have to document all the complaints and also patient history, whatever patient gives you and patient relatives tell you. And after that, you need to record the vitals. And what I observed you in casualty, most of the house surgeons are thinking that once they have a patient comes to, they are thinking that without any OP slip or any admission slip, they are not going to start the patient treatment. It is not correct. In casualty, especially when the patient comes to you in any emergency condition, your duty is to treat the patient first. He may not be having any outpatient slip. He may not have time to bring that slip to you. You don't have time to register in the hospital. Don't tell them, don't force them to bring the slip before your commencement of your treatment. You inform your respective postgraduates and seniors, and you immediately start attending the patient. Whatever the condition may be, you must have acquainted with the common clinical conditions which come to our hospital. In good olden days, there is a saying, doctor is a god. But in present day scenario, it is not the doctor who is God. It is the patient is a God to all of us. Patient is giving us opportunity to learn all the disease conditions by presenting himself to us. All the patients who are coming to our hospital having lot of faith on our hospital, on our system, they are coming to us to relieve their suffering. It is our duty to respectfully treat the patient and give our level best to relieve his suffering. And we have to maintain the proper records. That is what is lacking in our casualty. Wherever I go, most of the times, once you treat the patient, you have time to record all the clinical symptoms and also whatever the treatment you are advised or whatever the investigations you are advised to the patient, you can note it down afterwards. Most of the times, from casualty, they are simply writing name of the patient, just a brief note what the patient is suffering from, and refer to medicine, refer to surgery, refer to ENT, that's all. You have ample of time in casualty. Before the specialty doctors arrive to the casualty, you try to take all the symptoms and with the advice of the respective departments, you write the investigations. During my internship in Warangal, I did my MBBS from Warangal and internship also from Warangal. We used to go to hospital evening in medicine posting especially to give injections to the patients. I am not seeing any house surgeons coming to hospital to give injections. Everyone will think that injections giving is duty of nurse. Unless you are doing the same thing repeatedly, you will not become perfect. If in an emergency condition, any one of your relatives will ask you to give an injection, you will not be confident enough to give injections because you are not trained. So you will not have confidence to give injection also. Intramuscular injection, drawing the blood, intravenous blood. These things should be perfect by the time of your internship. If you have not attended these things beforehand, you try to learn all these things, intravenous injections, intramuscular injections, and also drawing blood, and also suturing the patient. These are the minimum skills which every MBBS doctor should learn. As JTR sir said, Madam Rekha Madam also said that during their internship they did minor surgeries also with the help of surgery department, hernia, hydrocele, and also the tubectomies we used to, they used to give us assistance, and also in anesthesia also we used to give a chance to do LPs also, lumbar puncture. Now no one is giving. If you go to private hospital, even final year PGs also sometimes they are not getting the chance to do the LPs, general anesthesia, intubation also we used to get a chance in emergency conditions. Wherever there is a chance, you try to expose yourself, even though you are not going to join in that specialty. As a basic doctor, you must be skilled in every department. This is what you are expected to learn during this 1 year internship. Wherever you are posted, whichever the specialty, we try to learn minimum skills that are required from a MBBS doctor. Don't think that only medicine, surgery, and pediatrics and OBG and orthopedic, these are essential in our life. We are going to join in the respective post graduation, then only we will learn. Other things are not essential for us. Don't think like that. Every subject is unique. Even though you are not going to join in specialty or super specialty of that particular subject field, you try to learn every skill of the subject you are posted. It may be a dermatology, it may be a anesthesia, it may be a any kind of posting wherever you are posted, and especially in intensive care posting. Try to learn what type of patient are coming to the intensive care wards, and try to follow up the case. We used to go to labs to collect the reports, so that we will know what is the lab report and how to follow up the case after different lab reports, how we are going to treat the patient. It can be a surgery. If you are posted in surgery, we used to go and collect the blood from the blood bank. Only they used to issue to the respective house surgeons only. Don't think that this is a duty of nurses or other people. Try to involve in each and every step of treatment of the patient. Then you will learn.
Aspect, whether it is general medicine, you have completed your investigation, proper management, anedi, you were taught all these days. So here, if the same management aspect, if the senior asks you, what do you think should I do with this patient? What is the treatment advice? You should be in a position to tell them, sir, I am thinking like this is the appropriate management. So if it is different, no, you have to do this also, ante, appudu adigali, why this is different. For all this, my simple advice is don't think that the books సంగతి అయిపోయింది పక్కన పెట్టేయాలి. So daily ఒక 5 minutes you spend any new case you see in the wards or in the casualty or in the outpatient. Just go on that day, go and read for 5-10 minutes about that case. That itself is enough. We used to have during, as Nagamohan sir has said, I am also from Kakatiya Medical College. I did my internship from Kakatiya Medical College. When we were undergraduate students, we had some senior interns who were teaching us during their internship. And we used to go and attend their classes morning 8 o'clock before the other members come. And you know, those interns have gone directly to All India Institute of Medical Sciences, PGHND. So that is the importance of internship. Don't think that I mean follow. You come, you were taught all these 4.5 years up to all these days you are taught. So try to implement whatever your theoretical knowledge is and see that if there is a difference or why different it is. And I'm very grateful, thankful to Nagamohan sir for arranging this program, induction program. And apart from my only request to Nagamohan sir is, apart from the protocols being taught to them regarding lab practices, blood bank, and because you will be directly involved with blood transfusions, what are the basic protocols? Apart from that, and dealing with medical legal cases and how to write death certificates and death sentence, I mean how you have to, what are the protocols to be followed? Apart from all these things, I am more concerned about my children. I'm more concerned they are directly dealing with HBsAg and HIV patients. So please, on the first go only, first let them understand how they should protect themselves. So అది ఆ ప్రోటోకాల్స్ కూడా మీరు ఇంక్లూడ్ చేస్తే బాగుంటుంది నాగమోహన్ సార్ HIV, HBsAg, so that they should know the proper so protocols to be followed, because you are directly dealing with the patients. You should also try to protect yourself, because day in and day out we'll be dealing with HBsAg positive, HIV positive patients. So you should also know all those protocols and how to protect yourself. So with these few words, I'm wishing you all the best. So congratulations once again.
Be responsible about the patient and our duties. If you are facing any problem, don't keep to yourself. You can